In this tutorial I'll be talking about the muscles of the gluteal region and how they act on the hip joint. So the hip joint is this joint between the head of the femur and the acetabulum of the pelvic bone. So it's this joint here, and this joint is quite a stable joint and it has several movements. So at the hip joint you get flexion and extension. So flexion is bringing the thigh up like this. Extension is bringing the thigh bone, the femur, back like this. You get abduction and adduction. So abduction, bringing the femur away from the midline. Adduction, adduction, bringing the femur towards the midline. And then you get medial and lateral rotation. So medial rotation would be rotating the femur inwards, and lateral rotation or external rotation is rotating the femur outwards. So you get these movements at the hip joint. So the gluteal region is this region between the crest, the iliac crest, and the gluteal fold. So the gluteal fold defines the lower limit of the buttock. So I'll just switch over to, so it's this, the gluteal fold is down here and you've got the iliac crest here. So it's this posterolateral region, the gluteal region. So I'll be talking about these muscles, the muscles in this muscle group. So what these muscles do is they extend, abduct and laterally rotate the femur. And it's helpful to think of these muscles in terms of deep and a superficial group. So I'll first talk about the superficial group and then I'll move on to the deep group. So the superficial group are these the larger muscle group. You've got these three large muscles, the gluteus maximus, medius and minimus, and these muscles abduct and extend the hip. And then you've got the deep muscles, which are much smaller and they're lateral rotators of the hip. And you've also got this muscle which lies more laterally, the tensor fasciae latae, which is also part of the superficial group. Okay, so just starting with the superficial muscle group, we'll take a look at the four muscles. So we've got the tensor fasciae latae. So this muscle originates on the iliac crest, just behind the anterior superior iliac spine. So just show you that. So this is the pelvic bone, and you've got the anterior superior iliac spine, and you've got the anterior inferior iliac spine just there. So the tensor fasciae latae originates just behind ACIS and just anterior to the tubercle of the iliac crest, so this little bit here. So it originates just on this bit here. So the tensor fasciae latae inserts onto this band of fascia which runs down the lateral aspect of the leg. So this band is called the iliotibial tract because it runs from the crest of the ilium, so from the tubercle of the crest of the ilium right down to the tibia, so iliotibial tract, and the tensor fasciae latae inserts onto the anterior aspect of this band of fascia. So what this muscle does, the tensor fasciae latae, it stabilizes the knee in extension, and it also stabilizes the hip joint. So it acts together with the gluteus maximus, which I'll just come on to. So it stabilizes the femur in the acetabulum, and it also stabilizes the knee joint in extension. So that's the tensor fasciae latae, and it's innervated by the superior gluteal nerve. So the gluteus medius, minimus and tensor fasciae latae are innervated by the superior gluteal nerve, but the gluteus maximus is innervated by the inferior gluteal nerve. So this is the next muscle I'll come on to. So this is the largest muscle of the gluteal region. So this muscle has this kind of rectangular shape, this quadrangular shape, and it has this broad attachment on the ilium and also the posterior lower parts of the sacrum and also the coccyx. So it has this broad attachment, and it has 2 points of insertion. So it inserts onto the back of the iliotibial tract and also onto the gluteal tuberosity on the femur. So let's just remove some of these muscles here. So you can see it inserting on the back of the femur, and it inserts on the gluteal tuberosity, and it also has this insertion on the posterior aspect of this iliotibial tract, so this band of fascia. So what this muscle does is it extends the flexed thigh, so it draws the thigh back like this, and it also stabilizes the hip and knee joints because of this attachment it has to the iliotibial tract. So this muscle is the gluteus maximus, and it's innervated by the inferior gluteal nerve. So next we've got the gluteus medius and the gluteus minimus. So the gluteus medius lies between the minimus and the maximus, and this is a fan-shaped muscle, and you can see its origin on the ilium here. So this muscle overlies the gluteus minimus, has its attachment on the ilium, this broad attachment, and it inserts laterally on the greater trochanter. So what this muscle does is it abducts the femur. So when it contracts, it abducts at the hip joint. So just under the gluteus medius you've got the gluteus minimus. So as the name suggests, this is the smallest muscle of the gluteal region. So this muscle also originates on the external surface of the ilium, and it originates, it inserts anterolaterally on the greater trochanter. So it also abducts the femur at the hip joint. So both the gluteus medius and the gluteus minimus are innervated by the superior gluteal nerve, along with the tensor fasciae latae muscle. So these are the four muscles of the superficial group. And then next we've got the smaller deep muscles, which are lateral rotators of the femur. So I'll just talk about those now.